And today we are discussing menopause. That's right. You heard me correctly. Menopause. Yes, men, you experience the change too, and we don't talk about it enough, but we're going to talk about it today. Menopause, as I like to call it, or also known as andropause, the technical term, is the hormonal shift that men experience when going through the change of life, typically at midlife. Now, like menopause in women, menopause or andropause can look very different from one individual to the next and begin at different ages. The more common presenting signs of andropause include the following: low energy or fatigue, low mood, depression, loss of muscle mass or difficulty maintaining muscle mass, muscle pain, joint pain, decreased sex drive, decreased morning erections, urinary symptoms, urinary retention or urgency, feeling tired but wired. Now, all of these symptoms are typically due to decreases in testosterone, but there's something else that can occur during andropause, and that is an increase in estrogen. Yes, men, you also produce estrogen, and during andropause, there can be elevations in estrogen, particularly for those who are overweight or obese, as more adipose tissue, i.e., fat, can yield higher estrogen levels. Now, this can present with some of the same symptoms that I mentioned that I described with drops in testosterone, but you may also experience anxiety, nervousness, swelling in the lower extremities, fatigue, burnout feeling, decrease in muscle mass, decrease in libido. So, similar to the low T. With that said, there are a battery of tests that should be checked when assessing for andropause. So, listen in and ask your doctor for these tests. Number one, free and total testosterone. You want to know unbound hormone and bound hormone levels. Sex hormone binding globulin typically rises as you get older and has a higher affinity for testosterone, thus less of the total testosterone is free, biologically active. LH and FSH to determine low testosterone being due to a testicular issue, primary hypogonadism, where there can be high levels of LH and FSH, or a brain issue, where there's typically low to normal LH, FSH levels, specifically dealing with the pituitary, which we know as secondary hypogonadism. You want to also check estradiol and estrone. Again, we need to know what hormone shifts are occurring, including abnormal levels of estrogen. I would also suggest checking a full thyroid panel. So TSH, thyroid stimulating hormone, free T4, free T3, and thyroid antibodies, as thyroid disease should be ruled out or assessed as a concurring issue where the presenting symptoms can be similar. Now, when assessing tests, it's important to understand that normal may not be your normal. So what do I mean by this? Well, oftentimes I will check testosterone levels for my male patients, and the numbers are within range, but if you look a little deeper,